Hey everyone, welcome back to the Deep Dive. Today we're tackling something pretty important,
Yeah.
the financial side of home care in Australia,
Mm.
especially with,
Yeah.
all the potential changes to funding coming up.
Yeah.
You sent over a really interesting mix of stuff, the Aged Care Act of 2024, program manuals, quality standards, and you're really looking for insights into the risks providers are facing and
Right.
how they might have to adapt. It's complicated stuff, but
Hmm.
we'll break it down together and hopefully uncover some of those aha moments along the way.
What really stands out to me is this idea of consumer-directed care. It's at the heart of the system, embodied in the Home Care Packages Program, or HCP as it's often called. The goal is fantastic, helping older Australians with complex care needs live independently for as long as possible. To do that, the program relies heavily on individual budgets and care plans. They're tailored to each person's needs and preferences.
That sounds great in theory,
Yeah.
but I can already see how that could create a ton of challenges for providers,
Yeah.
especially when we start talking about financial viability.
You've hit on a key point there, even before we get to potential funding changes. Just becoming an approved provider is a really rigorous process. They have to show they have the financial capacity and the know-how to manage these individualized budgets responsibly. There's scrutiny on their finances right from the beginning.
So it's not just about having a caring heart. You need to be a savvy business person too.
Absolutely. And things got even more interesting in 2021 with what they call the improved payment arrangements. While it aimed to protect care recipients, it also shifted a lot of financial risk onto the government, which, as you can imagine, created a whole new set of complexities for providers.
Can you give me an example of how that risk shifted?
Sure. Before these changes, if there were unspent funds in a care recipient's budget, the provider was responsible for managing them. With the new arrangements, that responsibility shifted to the Australian government.
Wow, that's a big change, and I'm guessing that makes financial planning and forecasting much trickier for providers.
You're exactly right. But here's where it gets really interesting, and where your sources start to paint a concerning picture. On top of these existing complexities, there's a lot of talk about potential funding model changes that could make things even tougher for providers.
Okay, let's talk about those potential changes. What are some of the key risks providers are facing?
One of the biggest concerns is the possibility of caps on care management fees. Providers are obligated to offer comprehensive care management services. This includes things like assessments, care plan development, coordination with other healthcare professionals. It's all mandated by quality standards.
So they're essentially being asked to do more with potentially less, which sounds like a recipe for burnout, both for the providers and their staff.
Exactly. And then there's the issue of maximum pricing for services. While the goal is to make care more affordable, fixed prices could limit a provider's ability to offer specialized services
Oh.
or tailor care to meet individual needs effectively.
Right. And what happens if the maximum price is set too low? Would that force providers to cut corners?
Mm.
Or worse, underserve their clients just to stay afloat?
It's a valid concern,
Hmm.
and it's something providers are understandably worried about. And the third big risk we see cropping up in your sources is the potential for co-payments for services.
That's interesting. It seems like a double-edged sword.
Mm.
It could make care less affordable for some recipients while also creating administrative headaches for providers, right?
Exactly. Providers might face increased administrative burdens related to billing and collecting payments. Not to mention the possibility of bad debts if clients can't afford to pay their share. It's a lot to juggle, and it all adds up to a pretty challenging financial landscape for home care providers.
Yeah, it really does feel like providers are being squeezed from both sides. Pressure to maintain quality while facing these potential funding cuts. It makes you wonder how they can stay viable long term.
That's the million-dollar question, isn't it? It sounds like they're going to need to get creative to weather this storm. Absolutely. They can't just keep doing things the way they've always done them. Adapting their business models is going to be critical.
So let's brainstorm. What are some concrete ways providers could adapt to thrive in this new environment?
Well, one obvious area is increasing efficiency, streamlining administrative processes, exploring shared service models with other providers. Those are all potential avenues.
Especially if those care management fees are capped. You really need to do more with less in that scenario. It's like squeezing more juice out of the same orange.
That's a great analogy. Another strategy we see providers exploring is service diversification. What if they started offering services beyond what's covered by government funding? Think private pay options for those who want additional support, or specialized care.
That's smart. It's like creating multiple revenue streams. Right. To buffer against potential losses from those capped fees or maximum prices.
Exactly, and it allows them to cater to a wider range of needs and preferences. Now, this next one might sound counterintuitive, but providers could also consider targeted service specialization.
Now that you mention it, it makes sense. If you develop a deep expertise in a niche area, maybe one with high demand or where you can command a premium, that could be a viable strategy,
Yeah.
especially if co-payments become a reality. You could attract those who are willing and able to pay out of pocket.
That's the idea. It's about playing to your strengths and finding that sweet spot in the market. But regardless of which strategies they adopt, there are some fundamental things providers need to prioritize.
Like what?
First and foremost, they need to continuously assess their financial viability. Are they operating sustainably? Do they have the resources to weather potential changes? That kind of honest self-assessment is crucial.
It sounds like financial literacy is going to be a must-have skill for anyone running a home care business in the coming years.
You're absolutely right. They also need to stay laser-focused on market demand and competition. What services are in high demand in their area? Who are their competitors and what are they offering? This kind of market analysis is essential for making informed decisions about service offerings and pricing.
And I imagine transparent communication with care recipients is more important than ever.
Couldn't agree more. Providers need to be upfront about their service offerings, costs, and any changes they might have to make due to funding pressures. Building trust and understanding is key to navigating these challenges successfully.
Okay, so we've talked about adapting business models. But what about the human side of things? How can providers support their staff through all of this? Because let's face it, these changes could be really stressful for the people on the front lines delivering care.
That's a crucial point, and it often gets overlooked. Supporting staff is essential, not just for their well-being, but also for ensuring the quality of care they provide.
What are some ways providers can create a supportive work environment in this challenging landscape?
Well, clear communication is essential. Staff need to be kept informed about any potential changes in funding or service delivery models. They need to feel like they're a part of the solution, not just victims of circumstance.
It's about empowering them, not just dictating changes from on high.
Exactly. And providing opportunities for professional development is also key. Equipping staff with the skills they need to navigate these new challenges can help reduce their anxiety and boost their confidence.
Right. If they feel equipped to handle whatever comes their way, they're less likely to feel overwhelmed and burned out.
Exactly. And don't underestimate the power of simply listening to your staff. Create a safe space for them to share their concerns, frustrations, and ideas. That feeling of being heard and valued can go a long way in boosting morale.
You know, it strikes me that this whole situation is a bit like a tightrope walk. Providers have to balance their responsibility to provide high-quality care with the need to stay financially viable in a system that's constantly in flux.
That's a perfect analogy. It requires agility, adaptability, and a deep understanding of both the care needs of their clients and the business realities they face.
It's a lot to ask, and I think it highlights the need for strong leadership in the home care sector.
Absolutely. Leaders who can inspire their teams, make tough decisions, and advocate for their clients and staff are going to be more important than ever in the years to come.
It sounds like providers are going to need a whole toolkit of skills to thrive. Financial savvy, marketing expertise, a knack for innovation, and a deep understanding of the human side of care.
They do, and I believe many of them are up for the challenge. The home care sector is full of passionate, dedicated people who are committed to providing the best possible care for older Australians.
That's reassuring to hear. Now, before we move on to the last part of our deep dive, I want to touch on something we haven't discussed yet, the role of technology in all of this. Do you think technology could be part of the solution for providers struggling with these financial pressures? Yeah, it's fascinating to think about how technology could be both a challenge and an opportunity for providers. We've been talking about all these pressures they're facing. Could tech help alleviate some of that burden?
I think it absolutely could. In fact, I'd argue that technology might be one of the keys to creating a more sustainable and resilient home care system.
Okay, color me intrigued. Where do you see the biggest potential?
Well, one area that's already making waves is remote monitoring. Imagine wearable devices that track vital signs, sensors that can detect falls, even smart home systems that alert caregivers to potential issues, all in real time.
Wow, so it's like having an extra set of eyes and ears in the home, even when a caregiver isn't physically present. That could be a huge game changer, especially for people living alone, or those with conditions that require close monitoring.
You're getting it. Not only does it add a layer of safety and support, but it also generates valuable data that providers can use to personalize care plans and intervene early if they see any red flags.
It sounds like it could also help with efficiency, which we know is a major concern for providers facing financial pressures. If you can remotely monitor someone's health and well-being, that potentially reduces the need for costly in-person visits.
That's a key point. And then there's telehealth, which has really exploded in recent years. Instead of having to travel to a clinic or hospital, care recipients can have virtual consultations with doctors, nurses, allied health professionals, all from the comfort of their own homes.
I can see how that would be a huge benefit for people with mobility challenges, or those who live in rural areas with limited access to healthcare.
Absolutely. It's about convenience, accessibility, and ultimately better health outcomes. And it can also help reduce unnecessary hospital visits, which is a win for everyone.
So technology can help with the delivery of care,
Yeah,
but what about the administrative side of things? Can it ease the burden on providers there as well?
definitely. There are so many innovative software solutions being developed, specifically for the home care sector. Think about systems for scheduling and managing staff, platforms for securely storing client information and care plans, even tools for automating billing and financial reporting. It's all designed to streamline operations and reduce that administrative mountain.
It sounds like technology could free up providers to focus on what they do best, providing compassionate care.
Instead of getting bogged down in paperwork and logistics.
Exactly. It's about working smarter, not harder. And ultimately, that's good news for both providers and the people they care for.
Now, I know some people are wary of technology, especially when it comes to something as personal as healthcare. What would you say to those who are concerned about privacy issues or the potential for technology to dehumanize care?
Those are valid concerns.
Yeah.
And we can't just blindly embrace technology without considering the ethical implications. Robust privacy protections are essential
Yeah.
to safeguard sensitive client information. And we need to ensure that technology is used to enhance human connection, not replace it. It's a tool, not a substitute for compassionate care.
So it's about finding that balance, using technology thoughtfully and intentionally to create a care system that's both efficient and deeply human.
Exactly. And I believe that's achievable. We're already seeing incredible examples of providers using technology to create more personalized
Yep.
and ultimately more humane care experiences. Wow, this has been such an eye-opening conversation. We've gone from exploring the potential risks and challenges facing home care providers to uncovering innovative solutions and imagining a future where technology and compassion go hand in hand.
It's been a journey, hasn't it? And I think it reflects the dynamic nature of the home care sector itself. It's constantly evolving, adapting, and striving to meet the needs of older Australians in a way that's both sustainable and compassionate.
Absolutely. And as we wrap up this deep dive, I want to leave our listeners with a final thought to ponder. Given all that we've discussed, the funding complexities, the need for adaptability, the potential of technology, what would a truly ideal home care system look like to you? How can we create a system that empowers both care recipients and providers to thrive? Those are big questions, but they're worth asking as we navigate this evolving landscape. Thanks for joining us on The Deep Dive.